Good morning, everyone. My name is Leslie Hoffman, and I'm a Deputy Commissioner for the Department of Medicaid Services, and I would sincerely like to welcome you today to our December monthly Medicaid virtual forum. We appreciate everybody that's on the call today and participating across our Commonwealth of Kentucky. It is hard to believe that it is the last monthly forum that we'll have here in 2025, but we will, of course, resume in 2026. Today is the Medicaid Monthly Virtual Forum, December the 18th of 2025. Next slide. Okay, just going to visit our agenda that we're going to have for you today. I've already completed the welcome and introductions to everyone, and then we'll go over the Medicaid renewals and state-based marketplace updates, our Healthy Kentucky Home Campaign Spotlight, KY Connect, and we have our 1915 I Rise initiative. We have our, which is a state plan amendment. We have a 1915C home and community-based community health for improved lives and development, and that is literally the acronym CHILD waiver. We also will have our Team Kentucky 1115 updates, and we have a couple of slides to go over for House Resolution 1, which is through the 119th Congress. So HR 1, we'll go over that as well. With that said, from the agenda, I'm going to turn it over to David Very for the Medicaid renewals and state-based marketplace updates. David?
Thank you, Dr. Hoffman. David Very, again, I'm with Health Plan Oversight and Medicaid eligibility and the Kentucky Health Benefit Exchange are my areas of specialty. So here's a little bit of both. Medicaid is enrollment trends are looking good. By that I mean steady. You can see on this graph we started tracking all the way back during COVID, during the pandemic. Hard to remember, right? But since the PHE or public health emergency has unwound, we're hovering at about 1.4 million or so lives who are finding their health coverage through Medicaid, which is good. It's a good solid number, and we're getting people the care that they need. Next slide, please. And yeah, we can see here the renewals are broken down by individual or by age and by month. Excuse me, wrong slide. We're almost there. And so 61,000 people have gone through renewal and had that process with a healthy 51,000 being approved and 4,000 were terminated. We still got a bucket of cases that are pending and that's working its way through the process. And next slide, please. Here's the one by age, and you can see that broken down by November. Our biggest bucket is that 26 to 50 year old range, and the termination is roughly the same, a little bit higher for that 7 to 18 proportionately, but still good numbers. And if we could, on the next slide, take a closer look at the children renewals. This actually is really, really good news. That most salient number on the far right, those are the passive renewals that happen without an RFI. So that means it's hands off for the persons involved. Go through the renewal passively, and then our system checks and databases do all the information that they're needed. They're not required to take action at all, and get renewed. The ones in the middle obviously are other ones where they have to take an active role, or sometimes it gets renewed, but the databases don't line up and that compatibility threshold isn't met, and so they have to turn in some information. And the next slide will show what happens when that information is not received. It still remains our largest bucket of why people are being terminated, is that they don't turn their paperwork in, or we can't get a hold of them, or there was some kind of verification that didn't happen. So my team will tell folks that I say this on blue in the face. It's so important that people read their mail, that people get a connector, that people are not afraid to open their mail if it's coming from the Commonwealth, and respond timely so that they keep that coverage. The smaller two buckets are categories are people who are just ineligible because of income, or maybe they moved or something like that. And then various other reasons, client request, or those sorts of things. And next slide, please. Oh, and yeah, what I was talking about before, stay covered. Read your mail. Know when your renewal is coming up. If you don't know when that is, contact the contact center. They'll tell you what date's coming up and help you with that process. And get that information gathering earlier, so you have the information ready when that renewal happens. You can I'll answer Priscilla's question when I see it in the chat. When when people are going through the renewal process, it's also important to update. Maybe your phone number has changed, maybe your email has changed, so that if we have a question, we can get a hold of you. Of course, on the phone call is not the only way. You can get a connector to help you, or you can, from your own living room, log into connect.ky.gov and manage your account that way. And we'll go on to the next slide if possible. Yep. And to everyone on the call who maybe you're not a Medicaid beneficiary, but maybe you know people who are, get the word out. We have tons of information out there that's constantly being updated. And it's good for feedback. If there's some information that you're not getting or not getting in the way that you would prefer, you can put it in the chat here. We'll take it back, or let us know, because you guys are our advocates and allies. And next slide. And spread the word about the renewals, for especially for the kiddos. Remember, we have continuous coverage in Kentucky, so even after a family might be determined ineligible, the children get that 12 months, no matter what's going on in their life. So make sure that that renewal happens, so that the process continues, and we really want everyone to be covered. We can take the next slide. Here's a whole host of resources available on the Medicaid website. It's really tiny print, but we do make these slides available on our website. So it's a great place to start to get information. And again, you can always give us a call. And speaking about added information, on the next slide, we'll talk about open enrollment. There is no open enrollment for Medicaid. I'm going to start with that. If you're Medicaid eligible, you can enroll that very month. You can change your MCO at any month. So Medicare open enrollment is over. There is no Medicaid open enrollment, but we are in the middle of the marketplace open enrollment. That's the Connect qualified health plans. And so get the word out. It did not end last week on December 15th. That was the last day to select coverage for January 1st. But all the way through January 15th, if someone does not have insurance through their employer, through Medicaid or Medicare, then Marketplace, you're hearing that in the news. That means qualified health plans through Connect here in Kentucky. We are open until January 15th to enroll you for 2026 coverage. And next slide. As of yesterday, we had 86,000 people who had signed up for 2026 coverage. Given everything that's going on, this is a pretty healthy number. We had 97,000 last year at the end of open enrollment. So we are seeing a decrease. We expected that given the changes in the tax subsidies, but the 86,000 is a really positive number. It shows that if they aren't Medicaid eligible, they're still able to find a place in the marketplace, not so much as a safety net, but as a springboard as they go towards other insurance through employer or Medicare as they age. 93,000 are new enrollees, people who have never enrolled with us before. That is an extremely encouraging number, especially given the winds of change that are out there. And it's higher than the number of people that we have lost so far. We have lost 8,000 and change enrollments from 2026 because of inaffordability is the largest group of people that we're losing. 14,000 people have actually come back and changed their plans, meaning things have changed with the tax subsidies. The plan is too expensive, but they're able to find another plan that meets their family needs. The biggest thing that we can get out there is stay covered. Even if it's going up, if you can afford to stay covered, please do. Because if open enrollment closes and you are uninsured, Just because you get sick in March or April or May, that isn't a reason, unfortunately, to sign up for private health insurance. So please get that word out, and also get the word out that if your circumstances change and you become Medicaid eligible, that will, of course, open that enrollment time for you. And we'll go on to the next slide. This shows year after year comparison. On the left-hand side, when we were a state-based marketplace, then we had steady declines when we were on healthcare.gov as people tried to navigate the two different systems. And slowly since the pandemic, and then steeply since the pandemic, we've been increasing the number of persons enrolled, with a dip so far this year, but we sure hope in the last month we can regain some of that territory, because the territory means lives insured, and that's what we're trying to do. And next slide. And yes, I think this might be my last slide. If not, I'll be fine. But please call the contact center if you have any questions at all. We are lucky in Kentucky that number, that 8554 Connect number, that not only is the number to sign up for the marketplace insurance or get questions about that, that also is member services for Medicaid. So you can get answers about what your Medicaid account looks like. Many times there are people who might have a qualified health plan marketplace for their parents, but the kids are on K-CHIP. You can find all that information out in this one location. And next slide. And here's some links to the Kentucky Health Benefit Exchange's own website. It's separate from the Medicaid website. It has more information, and a lot of it is very user-friendly. Fact sheets, resources. You can find out anything you were afraid to ask or know. We probably have a fact sheet about it, including some things that are new for this year. As a recap, new for this year, be careful. This is fertile ground for people who are trying to sell insurance products that are not compliant with the Affordable Care Act. They may sound too good to be true. They might come up with names that even sound similar to what's offered here. But the way to be sure, call the contact center, get a connector agent. They will explain it to you. And some other brochures and literature to help guide that way with some of the more complicated things that are being added. And as always, we're available anytime to answer questions. The next slide. All righty. And I don't know if there are other slides. Sorry, folks. But Connect is larger than just the state-based marketplace. It's actually larger than Medicaid too. From that one platform, you can explore options for SNAP, KTAP, child care. Remember, for people applying for SNAP, that date that they put that application is of the utmost importance, because your benefits actually are prorated in SNAP, sometimes known as food stamps, based on the date of application. So if you can get to that local connector and get that application in, sure, there's a process, there's an interview, there's probably documents you're going to have to turn in, but then when it's approved, that backs up all the way to that date. So it's great to explore that through Connect, through that single streamed application. We also have, in addition to all of that, we have Connect Resources. That's an electronic kind of interface with the United Way and some of their, or most of their organizations. So if you're a Kentuckian or know a Kentuckian who are looking for an AA meeting, or you're looking for help with transportation, or you're looking for where a local food bank might be, a connector in your neighborhood is going to be able to help you, and other social services as well. Or you can go here, and it can help direct you to where those resources in your very own community may be. So if you never checked out connect.ky.gov, check us out. And if you've never met a connector, this month alone, there are over 35 events happening today. Today, there are 35 events spread throughout the Commonwealth of connectors at the Pretty Blue tablecloths. And they can answer your questions. They can refer you to an insurance agent if you have a really complicated situation. They can help you start your SNAP application, or help you find resources in your community. our website on the links that was in the previous screen. There's a calendar of events. You can search by county, you can search by day. So come find us, ask us questions. We're here to help. And I'll kick it back up to Dr. Hoffman again, or I don't know where we're going next.
Sorry. Dr. Terrio, I'll let you take over to the next slide.
Oh, apologies,
You're,
ma'am.
you're fine.
I don't know if David wanted to answer the one question in the chat before I start.
Dr.
Oh,
Terrio,
you're
we were having a little bit of trouble with your speaker.
Oh, can you hear me?
Can
I
now.
can hear
Oh,
everybody.
okay. David, did you want to go over the
Oh,
question
a
in the
full
chat?
renewal packet for the passive with no RFI. Passive with no RFI means they're passing through when they're automatically approved. And so the questions are being sent a full renewal packet anyways. I believe the answer is yes before that it approves. I will take that back and follow up with you, Priscilla. I know that just changed, I think, last year of how much information we push out there, but it should be, at the very least, it's to verify that the information that we know that we have is correct. So it should be the full renewal packet. You just don't have to take action on it.
Thank you. Well, now we're going to shift a little bit. We're going to talk about our Healthy Kentucky Home. We've been doing this once a month for the last year. Now we're into year 2. So next slide. Year 2, woo! We, if you remember, last year we talked about 3 simple things that can be done, and you can do that to improve health and wellness throughout the year. And now we are going to keep that as our base, and we're going to add on every month a little spotlight on resources or programs that are available to everyone in the Commonwealth. And today we're going to talk about Connect. So next slide. So our basis is eating 2 servings of fruits and vegetables a day, not 3, not 5, but 2. You can do 2. Exercising regularly, 30 minutes a day, 3 times a week. So I know before we see each other again, we're going to have the first of the year and New Year's resolution. So don't decide you're going to exercise an hour a day, 7 days a week, like I sometimes do, or I don't, that's usually my resolution, not that I actually do that. But keep it simple, keep it doable. So 30 minutes a day, 3 times a week, and that's doable. And then engaging with others. So when you're connecting with others, when you're interacting with others, be it at a play date, at church, or even at the grocery store, when you're engaging with others, that is healthier for your mental health, for your well-being. Those connections make a difference, and try to engage every week with others. So next slide. So Connect, David did a great job of telling you all about it. It helps you connect to the benefits you need. So it's not just Medicaid or finding a qualified health plan. It is a connection to food and SNAP benefits, childcare, housing resources, different things like that. So it will actually help you connect in real time for real help. That's useful. Next slide. And talking about our pillars, no child or Kentuckian should go hungry. And so you can find those food options, the food banks, things like that, especially this time of year when the kids are out of school and they're at home, and you might have teenagers and oh my gosh, they just are bottomless pits and eat all the time. So this will help you find assistance out there with different organizations that can help with food assistance. Next slide. Like David said, it can also help you connect to the SNAP program. You can put in your application on the Connect site and get food assistance. And again, if you're thinking about it today, do it today because it is retroactive. So that's very important. Next slide. All right, this is my exercise slide, everybody. So exercise could be running a marathon, but look at this dude. He is just dancing. Exercise can just be dancing. Anybody can just dance to 30 minutes a day, 3 days a week. So not only is he dancing, he is connecting with others. Looks like he is at an event. And so Connect can also help you connect to things that will make it easier to have activities and connections. So go to that Connect website, help you connect with others, and it'll be healthy movement, healthy communities, and getting out there. Next slide. Staying connected. We're here at a holiday party. It looks like it really helps your mental health. So you can find all kinds of community resources, and the Connect site will also, because it's linked to that United Way site, it's you can search by locale. So you can search for things closest to you, what's available, and you can meet up and find services that way. So mental health, connecting with others, church functions, office, Christmas parties, things like that. Any other holiday party, it's important to get out there, and you'll be happy if you go out there and just like meet one new person every week. So next slide. And again, the Connect resources and benefits page, you can find things like childcare, heating resources. Oh my gosh, I don't know what my bill's going to be because of, last week's cold weather. And so other types of resources are available on this site, and it's very important and easy to use to just go there and see what types of assistance you can have. So next slide. Summing it up, Connect, we have the open enrollment for the qualified health plans through January 15th. So go there if you don't have insurance. It's really scary. Like David was saying, you can downgrade a plan. You can move from a silver to a bronze plan. You don't want to be stuck without insurance and get in a car wreck or break a leg and end up in the ER. Even for things that aren't that serious, those ER charges are huge. So, and that could be more than the premiums you pay every month. So it's important to make sure your family is safe and covered during this time. And so this guy's happy. He's connecting. Look at him. And I hope you guys have a wonderful new year. And we will be back to talk to you about more of the resources that are available to people in Kentucky. Thank you very much.
And 1915I State Plan Amendment RISE Initiative, we will have Department of Behavioral Health Tanya Dickinson.
Good morning. My name's Tanya Dickinson, and I'm with the 1915I RISE Initiative Development Team, and we are getting very excited because we're getting very close to being able to accept participants. Since I think most of you are already aware of the program, I'll just give a really quick overview of what it is and where we are at currently. Because I don't want to take up too much time as our mornings are always full. 1915I RISE is a new Medicaid benefit under Kentucky's 1915I state plan. That probably doesn't really affect folks here too much where that is, but that's for those who want to know the official title of it. That's what that is. It's different from a waiver. It's not because it's in the state plan as opposed to a waiver from the state plan, but it operates fairly similarly, although there are some differences that we'll get into with folks when we get to that detail level. It's designed for Medicaid eligible adults 18 and over with a serious mental illness with or without a co-occurring substance use disorder. And it brings 10 essential home and community-based services to participants in their community. The goal is to help individuals through recovery to independence by support and engagement, which is what RISE stands for, and to help them succeed in their communities. That's its most basic goal. By offering 10 services to individuals: assistive technology, case management, housing and tenancy, and in-home living independent supports, medication management, planned respite care for caregivers, supervised residential care, supported education, employment, and non-medical transportation. Everyone in the program receives an assessment And then once their assessment with them will help determine what services they need and would benefit from and would like to participate in, they'll be referred to a case manager that they're allowed to choose. And then the case manager will help them choose the providers for all of those various services. So it's a really exciting development, and it's very person-centered, and we're really looking forward to beginning to work with participants early next year. Next slide. Our current status is that we have 7 certified providers across the Commonwealth, with 70 plus, maybe 80 by now, somewhere in the application or the application review process. So there are more coming on as we go on, and that will continue, I'm sure, over time, as we always are going to be looking to expand our provider base. You can track as these providers come on by going to the department's provider directory, choosing 1915I and some of those services as subcategories, and you can see who is registered as a provider, and they've been certified by the Department for Behavioral Health, Developmental and Intellectual Disabilities, and enrolled with Medicaid rather, to provide those services. We are all about getting the word out, and so we have lots of methods for you to do that. I'm going to put into the chat contact information and web resources and all of those things that you're welcome to go to learn more about. And if there are anybody with providers on the call, we have a provider office hours that we run every Monday from 3 to 4. It's just a quick Zoom registration like for this meeting, and you can attend any or all of the meetings that we have coming up after that. And we're there just to provide an informal setting for providers to get their questions answered, everything from how to apply to what do we do now that we've already applied, and we're in our training program and getting registered and getting certified and that sort of thing. So bottom line, we are looking to start accepting participant referrals in early 2026. Stay tuned. There will be lots of updates about that as that comes online, and we are really excited to be getting off the ground. But I think that's really all I have for folks today. Like I say, feel free to reach out if we can answer any other questions for you.
Very exciting. Thank you so much. Next, we have the 1915C Home and Community-Based Waiver Program we just started. It's Community Health for Improved Lives and Development, which the acronym is actually Child Waiver. And we have Carmen Hancock, who is the Director for Medicaid's Division of Long-Term Services and Supports.
Thank you, Dr. Hoffman, and good morning, everyone. My name's Carmen Hancock. Like Dr. Hoffman said, I'm with the Division of Long-Term Services and Supports. We can go ahead and go to the next slide. And the next one. I'm here to talk this morning about some really exciting news with the child waiver. So like Dr. Hoffman said, Community Health for Improved Lives and Development. This is the newest 1915C home and community-based waiver in our state. It's designed to help Kentucky children and youth that have the most significant behavioral health or developmental challenges to get the services that they need, while ideally remaining at home, in school, and in their communities. The focus really is with children and youth with the most complex needs. So this might be children who are stepping out of an acute inpatient care or at risk of out-of-home placement. Perhaps they might be at risk of homelessness or experiencing homelessness currently. And they might be in these situations because of the intensive supports and services that they might need. The child waiver also includes clinical therapeutic services. These would be designed to foster a step-down approach for someone coming from maybe the highest level of care to return to home and their community. And there is a blurb there, anticipated January 2026. We are on track for that go live date. So we can go to the next slide. The target group for the child waiver, again, are children and youth under the age of 21 with significant behavioral health or developmental needs. And Kentucky children who need a level of care that looks like what would be provided in an inpatient facility, an intermediate care facility for individuals with intellectual disabilities, or a hospital, but they can be safely supported at home or in the community with the right services. And the next slide. The target group for enrollment in our child waiver program, again, as we mentioned before, are those with significant behavioral health or intellectual or developmental disability needs, who have exhausted supports and services that would enable them to remain safely in community. And they are either currently unhoused or at risk of being unhoused. They might have a history of at least 2 different foster care placements. They may have had at least 5 contacts with law enforcement, with juvenile justice, with a fire department or EMS, or something along those lines. It may also be a child or youth who is currently in an institution but is scheduled to discharge in the next 45 days. And next slide. These are the 6 services that are being offered through the child waiver. Obviously, case management, respite, community living supports, environmental and minor home modifications, clinical therapeutic services, which I mentioned earlier, and then that supervised residential care, which if those of you who have seen information on the child waiver previously will probably recall that I really do focus on this supervised residential care service in this waiver. This is the first Medicaid funded 1915C home and community-based waiver in our state that offers a supervised residential component for those under the age of 21. So this really is sort of a groundbreaking, very unique set of services that we're offering, and those that are much needed in our state. So we're very excited. Next slide. This is a little small, and my apologies for this. This is sort of a snapshot of, as a participant or a family member who thinks that your child might qualify for the child waiver. This is sort of a snapshot. This is a participant journey map that would walk a family through how to apply for the child waiver and how to move through to the point of getting services started. We are in the process of linking this exact document onto our child waiver website. So if you know someone, maybe it was someone in your own family, or someone that you work with, or any of those scenarios, if you know of a kiddo or a family who this program may be of a great benefit for, this will be out on our website no later than next Monday. I'm hoping for tomorrow, but it should be no later than next Monday. So this guide to help walk folks through will be available very soon. And we can go on to the next slide. We should have some current updates. So we did receive approval from the Centers for Medicare and Medicaid Services to go ahead and start work and go live with the child waiver. We got that approval on November 6th of this year. We immediately began outreach to providers, trainings, and are ready to start enrolling providers at this point in time. We this week conducted an in-person new provider orientation session, which was held on Tuesday. We did have over 100 people register, but we only had 84 who were able to show up. Based on the flu, the weather, and apparently strep throat. So There you go. But we did have 84 people who attended, who did show interest in becoming a child waiver provider. We were so thankful that those folks were able to make it. Um, and as news continues to unfold with this very quickly, we all have already received our first provider enrollment packet. So we are sticking on track. So excited to get this program up and running. We do anticipate services beginning in early 2026. The application should be going live and ready to be completed January 1. So more to come on that, and we will keep everyone informed as things are, like I said, unfolding very quickly with this waiver, which we're very excited about. And I think that might be the last slide, or we might have one more with resources. There we go. So we can take questions either at that 1915C waiver help desk or at the phone number that's listed there. There's the overarching cabinet for Health and Family Services website. We do already have our child waiver website up and running. The fee schedule is posted along with our other home community-based fee schedules on our website. And we did reference the regulations down there at the bottom. They are currently under review and we're awaiting approval. But we do have that waiver approved, so we're ready to go live. And I believe that's it. Thank you so much.
More exciting news. We are really doing well. These are things that we've wanted for a long time, and great teamwork across our cabinet. And some folks outside of our cabinet, we're just happy that we're actually getting to roll all this out. Very exciting and a lot of hard work. And these staff are going to be available through Christmas. And I know everybody's got holidays and things coming up. So we've got a pretty dedicated team. So thank you to all of our sister agencies and our team as well. So the next section that I'm going to go over is our Team Kentucky 1115 updates. And I know a lot of you all that participate. Next slide, please. A lot of you all that participate on these calls, I'm probably like, I know you've already heard this, but we have had some recent movements, so I'm going to go through them again. These these 1115 waivers get confused with 1915Cs, and like what Carmen was just discussing, they are not the same thing. It's a play on the word waiver. Waiver for 1915Cs is waiving the member and giving them additional things that they wouldn't be able to receive based on their diagnosis and things like that. So always think about like it's this carving out of a diagnosis for members. And with the 1115s, they're actually a flexibility that we're allowed to have if CMS says we can, and we waive certain Medicaid laws or rules. We can actually waive the rules. So it's a different play on a word. Still has a lot to do with the members, of course, but it's not the same word waiver. I wish they had kind of changed that. So I'm going to just kind of go over these. These were all combined, and we had some extensions on a couple while we were working through them, and CMS kind of wanted us to get them all aligned. So they were all approved December the 12th of 2024, and they will run, because it's a demonstration, they will run through December the 31st of 2029. So first of all, what is an 1115? It's kind of what I talked about before. It's a flexibility that if states are willing to do so, they go to CMS and say, let me think outside the box. I think I could come up with something equal to or less than the cost of I'm spending now and come out with a better quality of life and a better outcome for the members, right? So we have to ask for what we call an authority. And our Team Kentucky Section 1115, think of that as the umbrella. Okay, we started out with the big Team Kentucky, which we renamed from a previous administration. So it's now Team Kentucky, and that is our overarching umbrella. And then after a while, CMS said, "Okay, Kentucky, you're getting a lot of these. We don't want to roll them all up into one. We're going to start developing arms." Under this Team Kentucky 1115 authority, and it's the authority to ask for flexibilities. So each one of these that you see under Team Kentucky is flexibilities that we've asked for to waive certain CMS requirements or rules And we've told them that if you'll allow us to do this, that we will watch over budget neutrality and we won't spend any more money and that we will do lots and lots of reporting. These on the reporting side are probably several times greater than the C side for data reporting. We have to constantly show metrics and outcomes and reporting every quarter and then every annual, and then there's a 6 month evaluation. It's constant for these, very, very hard to get through all of it. So just real quick, I thought I'd go through these just one more time. Now, mind you that many of these have legislative requests that went along with them over the years. So our out-of-state former foster care is just what it says. It's the ability for us to cover out-of-state former foster care. So it's just what it says. Our SUD disorder, SUD, or our addiction 1115 extension is really about allowing for an extension of days in IMD stays for SUD. And so this allows us to go above and beyond the current required days of stay, not to go over. We can go up to an average stay of 30 days now. When I say an average stay, so there can be more than 30 days. But it cannot be more than a Kentucky average of 30. So we're constantly monitoring this. We're constantly watching over this and sending information to CMS about our SUD 1115. Our reentry is one that's coming on board. We're so excited. We've been working on this for several years. We actually applied for a reentry. Back then, we called it an incarceration 1115 before CMS even had it as an option. So it sat on CMS's desk for a while trying to figure out what to do with it and them to get the reentry 1115 opportunity out and about for Kentucky and other states to apply for. We actually submitted ours first. California actually got theirs approved first. They were a little bit farther along. They had been running some pilot projects and were able to get up and off the ground. We participate in lots of things related to reentry on a national level. We speak, we help other states. This has been a very exciting opportunity for Kentucky. So two things to remember in reentry is there's two components. You'll have the adult component, which is for those that are incarcerated or in confinement. And those are the adults that we will be providing. We got approval 60 days prior to release to start assisting that individual to be ready and prepped to go out into the community and assist them to be successful. We can also cover, medications at the time of their release, a 30-day medication release for both physical and behavioral health medications. We can also provide screenings and all those kinds of things, trying to get ready for their release. And then they will choose the MCO of their choice prior to leaving, and the MCO will follow them for a very comprehensive kind of enhanced case management for up to 12 months after their release. So this is very exciting. The second component of reentry is called CAA, which is the Consolidated Appropriations Act, and there's requirements and there's other options that we are looking at. The requirement comes out of 5131, and I'll go over that a little bit with you, but this is to allow us to also help the youth that are detained. We are starting in our youth development centers here in Kentucky, and we have already rolled out with one kind of as a pilot, and I'll go over that with you. So you have an adult component, reentry, as well as the CAA. We call the piece for the youth Kentucky Cares. That's what we call it. And we also have a grant that we're waiting for funds to also be released to assist our sister agencies and our partners, such as Department of Juvenile Justice and the Department of DOC. Department of Corrections. Serious mental illness. We just recently got this one, our implementation plan approved. We were so very excited, and I'll go over that a little bit. But for serious mental illness, it's very similar to the parity needed for the SUD. It allows for us to increase the days of stay in an IMD and not to go past a 30-day average stay. So that's our serious mental illness. We just received approval for an implementation plan. As you all have heard me talk before or speak before, Even if CMS approves these waivers, I don't get to start them immediately. I'm required to complete all these different components. And one that's very important before we can implement is called an implementation plan. So we just got that approved just recently, and we have sent provider letters out, and I'll go over that. But I just wanted to explain what the serious mental illness was. The serious mental illness 1115 has a related or companion component that CMS is now termed as the health related social need for recuperative care, and we have a pilot. I'll go over that with you. The pilot is really to allow individuals who need short housing stays, like I'm talking about, like a couple, for example, you might have a person who is homeless, but they've got a surgery coming up and they'll need a clean place, safe place to stay a couple days while doing prep for surgery, or maybe they need a clean, safe place to stay right after surgery with maybe wound care and things like that. California, I believe, is probably one of the only states that has what we call recuperative care. You may also hear it called medical respite. So, for example, when Senate Joint Resolution 72 came out, there was several things that they were very interested in through legislation for us to get approved. That one required three authorities. We did a serious mental illness 1115, a health related social need 1115. Those are companions. And also the the 1915I RISE initiative that Tanya spoke of earlier. These are all three companions to each other to meet Senate Joint Resolution 72. And I know that's confusing, but it's about what authority or flexibility we needed to have, right, in order to meet everything that we were being asked to develop. So very exciting. I'm very pleased that this is up and off the ground. We've been working for probably 25 years to have some of these pieces in place, and it's very exciting to now see them coming about. The last one that you'll see on here is called the Recovery Residential Support Services. We call that the RRSS, and that really came out of, if you all remember, Senate Bill 90. So Medicaid had a piece of Senate Bill 90 to also assist with those coming out of incarceration with SUD, and we could not pay for room and board, but we are able to pay for services in a location. So even though I couldn't pay for a residential service room and board, I can pay for services in that location. And our staff got really creative with how to get this approved, and it was approved. And I'll go over the timelines in just a little bit. So again, Team Kentucky Section 1115 is our overarching authority to ask for flexibilities in Kentucky. Okay, and then all these under these are different flexibilities that we have requested, rules that we have asked CMS to allow us to waive in order to provide something different in Kentucky that we think will provide better outcomes, better care, better satisfaction, right? And better care for the member. So I know I've been over this before, but there you go. Okay, so next slide, please. So I've got two things combined on this one. This is our Team Kentucky 1115 and kind of all of our time frames weaved through it, but it also includes very specifically our CAA or our Consolidated Appropriations Act, and we call that Kentucky Cares here in Kentucky, and that's for the youth that are confined. And that is a requirement through the Section 5121 of the Consolidated Appropriations Act. I hate to just call it Consolidated Appropriations Act because that has a lot of things in it besides just the youth piece. So if you look at October of 2025, you'll see the initial reentry deployment. We actually started out with one youth development center for CAA. On December the 8th of 2025, as I mentioned before, our implementation plan was submitted and approved. We are so excited about that one. December the 15th, the SMI 1115 provider letter was sent out. Just to let you know, we also were able to get our state plan amendment for CAA. It's an alternative benefit plan out and submitted to CMS as well. Winter of 2025, new provider types are in development for recuperative care that I told you about, and recovery residential recovery supports, which is our RRSS. And we are currently in system testing for reentry. January the 15th, per CMS, can be our implementation date for the SMI 1115. Very excited about that. And then we've got the January 2026. We'll continue to work through our residential recovery support provider webinar and our recuperative care pilot provider kickoff. So we're really close on those. April the 1st of 2026 will be the full implementation of reentry adult, and then CAA will roll out a phase two. As I mentioned earlier, we rolled it out with one youth development center, kind of a pilot deployment. And so we're ready to go forward with the CAA phase two. We will also start working through our recuperative care pilot and our residential recovery support services. On into spring, we've got more to do for CMS in order to keep these 1115s going. We have monitoring that I told you about and also evaluation. What most of you all probably don't know, we are also required to have an impartial evaluation of every one of our 1115s to ensure that we're doing what we told CMS we could do. So like I said before, there's a lot of work. There's a monitoring plan and an evaluation that has to occur. Summer of 2026, our CAA phase three, and then winter of 2026, our CAA full compliance. So although you all may have heard that CAA had to be kicked off in the federal world, CMS is allowing us, because we had already started, to align in year 2026 with reentry for a CAA full compliance. So we're very excited about all the hard work that everybody has done. Um, I can't even tell you how happy I am and pleased with the team that has worked on this. If you all know Angela Sparrow, she's unbelievable, and she kind of heads up all of our Team Kentucky 1115. And then we have individual folks such as Jody Allen that is working tirelessly over our SMI and our recuperative care. We have other staff. I won't go on, but this has been an extreme amount of work to get done, and now it's all rolling out in 2026. So as you heard Carmen speak, Tanya speak, there's so many things that we're rolling out, and so happy not only for our folks here but for the members of Kentucky for this to be available to you. So just exciting times. Next slide, please. Okay. I'm just going to do a little bit on House Resolution 1, or HR 1 is what we usually call it. I'm going to just go over a little bit. I'm not the guru at this, but I do stay up to date with what we have going on. Next slide, please. Okay, so lots of folks ask about HR 1, 119th Congress. What's going on there? The most questions we get, of course, is about Kentucky Rural Health Transformation Program, RHTP. You'll hear us mentioning it, RHTP. Now, I do want to mention, just for sake of not getting confused, our Department of Public Health, Dr. Langfeld, which is now the commissioner for the Department of Public Health, is heading up this initiative. While we're all involved, it is being headed, the head is Dr. Langfeld. So I'm going to give you some current status and next steps. I'm not going to go over all the background because it goes all the way back to August, but I wanted to highlight a few things that we've got highlighted here. So on November the 3rd, we completed the application and submitted for review. On 11/5, we sent the application to it was due to CMS. I'm sorry, we actually submitted the application on the 3rd, and it was not due until the 5th. CMS has also indicated, for your knowledge, that there will be budget discussions before the final approval. So we're not in final stages yet. And on 12/31, CMS is supposed to announce the RHTP awards. It'll be early of January of 2026 when CMS is supposed to distribute the funds for the first budget period. So that's kind of where we are right now. I just started kind of from November forward, so you all would know where we are. The next thing that should occur is that CMS should announce the Rural Health Transformation Program awards, and we should be hearing from CMS if they need to negotiate anything or need any additional questions answered in those things. So it's not in its final draft right now. So that's why we have not posted it. It's considered a work in progress with CMS. Next slide, please. I'm not going to go over all these pieces, but what you need to know are the 5 components, the proposed initiatives that we're focusing on with the rural health transformation. It's rural community hubs for chronic care innovation, reduce obesity and diabetes rates through evidence-based community-led strategies focused on upstream prevention, powering maternal and infant health community-based teams to increase timely prenatal care in maternal health what we call deserts, through coordinated telehealth enabled teams. Number 3 is our rapid response to recovery. We're looking at empath models for here in Kentucky, mobile crisis and telehealth to expand integrated technology enabled crisis care from community response to long-term care. Number 4 is rooted in health. This is our rural dental access program to improve rural access to preventative dental care and treatment through expanded training and mobile portable services. And number 5 is from crisis to care, integrated emergency medical services, EMS, to trauma response to strengthen capabilities and capabilities and capacity for pre-hospital care and in-place interventions. So these are the 5 components that we looked at. And we have to look at these in order to, also related to workforce development, sustainable access, innovative care, those kinds of things. Next slide, please. So eligibility changes, I just want to go over a few of these. October eligibility changes, some eligibility changes for immigrants. December the 31st, work and community engagement, if you've heard about that, requirements, and 6-month redetermination for expansion population. January the 1st of 2027, retroactive coverage limits of a month for expansion, 2 months for all other groups. And October the 1st of 2028, cost sharing for expansion adults. I want to ease your minds just a tad that we will continue to come to you and talk to you about these things. This is not the last time you will hear about it. We will continue, Medicaid will continue to communicate about these things that are coming forth. Just as a note, as you can see on this slide, eligibility changes are on the horizon. Currently, we are assessing the requirements and we'll be providing updates as they occur, just like I said to you through our communication. We are awaiting some additional guidance on a couple of areas from CMS that's not been released yet. We highly recommend from Medicaid that folks sign up for our distribution list and to watch our social media constantly for information. We have all the social medias now, the most popular ones. I would suggest you, check those out. We post regularly for those, and we plan on having a lot of information that will be going out through those channels. So that's just what's on the horizon, but I don't want you to think this is the last time you'll be hearing about it. Our Senior Deputy Commissioner, Veronica Judy Cecil, is excellent at making sure that ample communication goes out to communities and folks that are in need. Next slide, please. Questions, and then next slide. So, open call for topics of interest. Blaine and others are always looking for things that you'd like to hear about in the future. We will resume calls in January. Just look and see if we're getting any questions here. Not so far. If you have any questions, you can put them in the chat or reach back out. Blaine, let's just give a few minutes for questions.
Sounds good.
We may have just done a fabulous job answering those questions already. Not seeing any questions come in. Again, we thank you from the bottom of our hearts for joining us during the holidays for this December forum, and we will see you in 2026. Thank you so much and have a great day.